Thank you for joining us today on the Clinician Voice podcast series. I'm Robin Geiger, Chief Nursing Officer for Ingenivis Health. In honor of Allied Health Professionals Week, we have the pleasure of welcoming my colleague and the president of a staffing company who's leading the way in advocacy for the profession. Kelly Duggan, president of Trustaff, is a distinguished executive with over 20 years in the healthcare workforce solutions industry. Prior to her current role, she was the Senior Vice President of Integrations and Continuous Improvement for Ingenivis Health. She is a visionary leader recognized for driving enterprise-wide operational excellence and strategic workforce solutions with interprofessional collaboration throughout our company of brands. Please join me in welcoming Kelly to the podcast.
Oh, Robin, thank you so much. What a great introduction. You make me feel so welcome and special. And of course, that's Dr. Robin Geiger to all of you who are listening. So honored to get to work.
Robin to you.
Robin to me. So honored to get to work with you. So thanks for having me. I'm really excited to be able to talk about our allied professionals and how they have an impact on the overall industry, and just excited to be a part of this podcast.
Likewise, thank you. So I'm excited to share some of the great things that you're working on. So let's get into it. If we could start with you sharing just a bit about your background and how you evolved to this leading position in a travel clinician company.
Great. So as you mentioned, I've been in the industry for a little over 20 years. And I'll tell you this, probably the biggest thing that I can offer is that I say yes to just about every opportunity. Somebody says, do you want to work on this project? I was always very quick to say yes, I would love to. A very inquisitive mind and love to learn and to do more. And also have a focus on how do we do better, right? This continuous improvement. You heard that in the last role that I had at Ingenivis Health, was really focused on that and thinking about how do we make it better for the clients that we serve, the clinicians who we get to work with, and obviously at the end of the day, the patients that we impact. So as my career has evolved, it really has been just that focus of, learning as much as possible and getting my hands on every bit of the organization. So I have had a varied roles within my career. So think tax, payroll, contracts, sales, recruitment, account management, you name it. And I've pretty much done it that touches our industry, which is pretty special for me. And I'm really proud of the work that I've been able to do.
I love that. It shows a lot. It shows a lot about your character and why we value you so much. But there's a lot happening right now in healthcare, and we're going to get into some of those things. I'd first like to talk about, how has your leadership approach changed over time to address the constant challenges within healthcare?
That's great. I think the first thing that I will say, and this has really kind of become my personal mantra, is allow grace for yourself, for myself, and for others. This is a very, healthcare in general is always evolving. Healthcare staffing is always evolving. And especially as we're coming out of, a couple of years now out of the pandemic, the face of our industry really has changed. So that grace is critically important. I'm also a big believer in accountability and doing what we say we're going to do. And if we don't, being, held accountable to the reasons of why and what support we can lean in to help with one another. And obviously, I also just like to have fun. So I'm a big believer in that too. We spend the majority of our awake hours with our work colleagues. And so we should enjoy what we do and who we do it with. And I want that to permeate throughout our organization.
Love it. Let's talk about allied health professionals. So we're doing this in honor of Allied Health Professionals Week. What are some challenges that allied health professionals face today in terms of visibility and recognition? And what are some ways that your organization elevates these key individuals?
That's a great question, Robin. Despite being so critical to healthcare, allied professionals, people like respiratory therapists, physical therapists, lab techs, et cetera, often don't get the visibility and the recognition that they deserve. Some of the main challenges that I feel like they're up against is underrepresented in leadership and decision-making spaces. Often these professionals don't have as much say in the big picture of patient care, which can leave them feeling undervalued and out of the loop. And then, of course, there's also the issue of public awareness. A lot of patients, even some on the healthcare team don't fully understand the scope of what allied health
True.
clinicians do, right? They have a
Right.
better sense of what a nurse does and what the physicians do, but they may not understand how a respiratory therapist fits into their care team. So I think that those are some of the big challenges. And then the other hurdle, I would say, from an allied professional's perspective, is that they feel like they're in supportive roles rather than essential roles. And so we just need to elevate that recognition and honor of what they do on those multiple disciplinarian teams.
Right. I think the last piece that you mentioned really, it really struck a nerve, just ensuring not only that we're recognizing them, but other health systems are recognizing them as essential part of the care team. That's really big, and we need to continue to do that. What do you foresee as the future of travel healthcare? I know that this is our predominant space.
Yeah.
So how do you think allied health clinicians will continue to shape this area that we work in?
I think that that is an amazing question. I wish I had a crystal ball, but I'll tell you what I think and what we've kind of gleaned from what we were seeing. Obviously, the travel healthcare industry, so the work that we do of placing clinicians on contingent assignments, has gone through such a big transformation. And the allied health clinicians, like those that I mentioned before, are right at the heart of it. So we see some trends that are coming up. So there will continue to be a large demand for specialized allied positions, especially in rural and underserved areas
Absolutely.
where you have to
Mm,
be able to take care of those patient populations. Think
right.
remote and telemedicine and how the allied professionals can help in those
Mhm.
areas as well.
Right.
Is just also the need for flexibility, right? So think about patient ratios and the number of cases and so forth in an allied professional, and just being able to be flexible along, with their work schedule and where they want to be from their own work-life balance perspective and their caseload, and then just making sure that we're looking at that. And again, I think that there's also this preventative care and the chronic disease management. It's
Mhm.
another big one, as you know, that we're finally leaning in as a society in preventative care and not just the
Yes.
treatment. And our allied health clinicians who specialize in physical therapy, nutrition, occupational therapy, and so forth are really critical to managing these
Right.
chronic conditions. So we just need to continue to lean in to that as well. And then, of course, there's a whole nother layer of technology and how do we leverage technology for these practitioners as well. And so I think the other is, I think we learned this through the pandemic, it's just the crisis response and we know what a huge role they played
Right.
during the COVID-19
Mhm.
pandemic in the respiratory space and the other natural disasters. So we need to just think about how we, like Trustaff and our sister company FastStaff, can just make sure that we have allied professionals at the ready to be able to respond to those crisis needs. So being able to build out that bench, if you will, of professionals. So those are a few areas that I kind of think I'm thinking about from a future perspective.
No, I think your crystal ball is working quite nicely, actually.
I hope
Nice,
so. There's a lot of
nice
smart people
foresight.
that I think there's just a lot of smart people that have helped shape that for me a little bit.
No, I love that. Let's talk about the current impact of stress and mental health for clinicians. I say this while I take a deep breath and kind of, pace myself as well. What is your current experience with clinician burnout or ways that this has shaped your work?
Yeah. Clinician burnout and mental health are huge issues right now. And honestly, they've probably never been more critical. It's been my experience, burnout doesn't just affect the individual clinician, it impacts the entire healthcare ecosystem, from the patient care to the team dynamics to the families. So, in reality, is that the clinicians, regardless of whether they're a doctor, a nurse, or an allied health professional, they're often running on empty. Their
Right.
gas tank needs to be refilled, right? They got to long shifts, high stake decisions, the emotional toll, all that
Right.
stress is relentless. So we definitely have to think about burnout and how we support these clinicians and the critical work that they're doing. In terms of how it's shaped my work, it's made me a big advocate for support systems for our clinicians that address in a genuine way their well-being, not just, a poster on the wall, but really how do we care for our clinicians? And I know that you're going to talk a little bit about what Ingenivis Health is doing in a real way a little bit later with our ACT program, but just I know that that's really important, and I'm, a huge supporter of that program. And then, of course, we have other resources available to our clinicians, from, employee assistance programs, our ACT program, our clinical management team, and so forth, to really just help them with their burnout and their mental health support.
Right. No, and you're right. There used to be, it was almost checking the box on how we support what our experience is with burnout, like a pizza party for this and a reminder for this. And we want all the things. Those still buy the pizza.
Yeah, still do the pizza.
Right.
But we have to do more. And we have to also look at it from a systemic perspective of like, what's causing the burnout? What's causing this fatigue? And how do we support and lean in a better way?
Absolutely. We want all the things. We want all of the things.
That's exactly right. So I just think, I think it's also just how we should look at success in healthcare, right? In that it's not just about filling positions or meeting quotas. It's about placing clinicians in environments that are supportive to their well-being and allow them to thrive long-term. And when a clinician feels cared for, they're more engaged, more productive, and they'll ultimately deliver better patient care themselves.
And they're more loyal as well, right?
Well, yeah, there's definitely a loyalty aspect. I am about retention with our clinicians as well.
Wonderful. So the fact that you have such great insight into clinician burnout, and thank you for that answer, because that was all encompassing, and it was really great to share with the listeners and kind of remind them, this is where we were, this is what we need. How do you prepare your team to support clinicians who may be experiencing burnout?
That's, I had to actually pause and think about this, because do I have like just a standard answer? And I think that this is something that we practice really well, and then we just need to focus on, and that's slowing down enough to listen to our clinicians. And so hearing what they're saying and being able to support them where they are. So, no, I don't want to travel 250 miles away from home. I'd like to be within 100 miles, or, what's going on with their family that may have an impact on that particular assignment or whatnot, or what they might need with their career development. So slowing down enough to listen. And then I think beyond that, it's being patient and providing resources to the individuals, and then leveraging our internal resources, again, like the ACT program, our clinical management team, who are there to help support, as well as our other liaisons within the organization.
Okay. And you mentioned the ACT program a couple of times, which you know that I'm very proud of. And just to remind our listeners, the ACT program is a program that's unique to Ingenivis Health. It supports clinicians through advocacy, career support, and also provides tools to improve work-life integration and well-being. So we're definitely proud of this program. What are some of your favorite tools within this program that support allied health professionals and all the clinicians that we serve?
All the clinicians and all the things. Yes. All of them. There's so much to it. So it's like picking a favorite child almost. So what I'll say is there are several critical components that I really when I'm talking about ACT program, I talk about probably the most. The scholarship program, helping our healthcare professionals further their education, to keep them at the bedside and along their career journey, as you talk about that talent ecosystem. I love that we're funding those and we're giving scholarships to those who are needing them. So I love the scholarship program. This podcast is actually really cool too. I love being able to hear from our clinicians and from our other business partners and whatnot. This is a great resource. It's also a good way to kind of unplug and just hear what's going on, right? So it's really good. And then probably I'd say, if I had to name a favorite child, it's the Excellence in Action, right? It's a place where we get to honor the clinicians and their contributions through the various recognition avenues or pipes, if you will. And so I just love that. And so being able to recognize that hard work that our clinicians do is really important, and I think is special.
Thank you. And if viewers could see me, they would see I have this huge smile, because I'm really proud of everything that you just mentioned.
You have done I truly love our ACT program and the difference it makes, and that we
I
get to
love
be
it too.
part of it. So thank you for your hard work in building it up.
Well,
I
and
love
thank you.
it.
Thank you for talking about it. I mean, I think our all of our executive leadership team, our senior leaders, we do a great job at really circulating this program around and bringing some attention to others, hopefully as an exemplary model of this is how we hope you would treat clinicians in your space as well. So thanks for that. It helps our listeners to hear the stories and just lived experience of our guests. And so I really appreciate, again, for you sharing that. Um, what are ways that you practice self-care to reduce stress, and how do you encourage self-care within your circles and your healthcare team?
So I'm going to go back to give yourself grace.
Yes,
So that is, I do believe
so
that,
important.
to my core, I believe that. I travel. My husband and I love to travel. So I often say that I work so we can travel. So we do
Okay.
that pretty extensively.
I love that.
And I have a great support team that when I'm off work, I actually get to unplug for the most part, and I get to be off work and be present with my friends and family, which is obviously critically important. I also have two dogs and a cat, and I'm very involved with one of my dogs. We compete. And so we compete in obedience and agility and sniff work. And so when you are in the ring with your dog, you can't think
Love
about
it.
anything else that's going on besides what's going on with your dog. And such a great way to just bond and connect there. So that's a great stress reliever for me as well. And then for encouraging my team, it's really the same thing. I take the time off. Don't check your email. We'll cover it. We will make sure that things that need to get taken care of will, and the rest of it can wait. I do believe in putting family first. So my team, if there's a ball game they need to get to, or if there's a pageant or, whatever it might be, that they're putting their family first. I had a wise leader who reminded me one time when I was trying to juggle a personal obligation and a work obligation. She said, you're not going to look back in a few years and regret missing this meeting. You'll regret missing that family opportunity. And she was
Heard that
100%
before.
right.
Hmm.
And so you do that, right? And it's prioritizing. And the work that we do is critically important and critically valuable because of the impact that we have on patients' lives. And so we need to be refreshed and we need to manage our stress so we can continue the good work.
Awesome. Okay. Looking ahead, how do you see allied health professionals influencing the future of healthcare delivery? And what roles should leadership play to ensure that they're supporting these professionals to get where they need to get, accomplish their goals?
Yeah, so I think that it goes back to what we were talking about at the beginning of the
Yeah.
podcast, and just making sure that there is that recognition of the contributions that the allied professionals have to the overall care team, and not just to their peers, but obviously to the patients. And so there's just more education that needs to happen, and making sure that, the allied groups are represented at the leadership level as decisions are being made that are impacting their departments and their personnel, that they're at the table and at least have a voice. And so we should continue to advocate for that with our clients.
I agree. And I think you touched on care teams, which is very important to allow them to practice to the extent of their license, let them really grow, because that allows us time, like nurses time to do other things. And so I think just, looking at innovative ways that we can continue to utilize them and expand their contributions to care is important. So thank you for touching on a bit of that as well. Okay. And I know we're winding close, but as a leader in the travel clinician space, what advice would you give to other healthcare leaders in hospital systems and agencies looking to better support this group?
So I was thinking about this in terms of my competitors, right? So
Mhm.
do I want my competitors to be better? Because I like to win. So,
Love it.
however, I will say, for the betterment of the overall industry, which is really what's important here,
Right.
it's friendly competition.
Yes.
is that we just need to make sure that we're supporting our clinicians, that we're giving them the resources and tools that they need for their career decisions, and making sure that we can get them to the clients who have the greatest need and make sure that the patients are being taken care of. So I think that it's just making sure that we always are putting those clinicians first as we're making our business decisions that are going to impact them. I kind of think about it in two prongs. So I think about our clients, the hospitals, the healthcare systems, et cetera, and we need to make sure that they have a good experience and we're providing the quality clinicians that they need for their patient population. And then I think about our clinicians as this secondary client, if you will. And so it's really making sure that we have both supported and whatnot. So that's what I would say there. And then as it relates to our clients and how they should think, the hospital organizations or healthcare organizations, how they should be thinking about this is really thinking about it in terms of how do you balance your workload, your workforce to make sure that one, there's cost savings that go into it, right? So how are they fiscally responsible to their patients and their shareholders and stakeholders, et cetera? And so we want to make sure that the resources that we're giving them are the most effective for the prices that they have to pay. So you want to balance that from a workforce perspective, right? So what does their core staff need to look like, and how do you then augment that with our contingent or travelers? And so just being really mindful about that from a holistic approach, because we want to make sure that we have great orders and great assignments for our clinicians to go on. And we want to make sure that we're sending the top quality candidates to our clients.
Yes, I agree. And we definitely focus on leadership, clinical excellence. So I love that we're surveying our clinicians, that we're listening to them. And yes, I think the advice that you gave, I think it was just enough. I don't think you gave too much to our competitors. It's great.
No secret sauce. I think it's just about being better, right? It's just being better, doing better for one another. I think that's really the ultimate.
Agree. I love that. So looking ahead, what are your key goals? What can you share with us about what we can expect to see from Trustaff and Kelly?
Yeah, I think my primary focus is for us to continue to deliver excellence for our clinicians and our clients. I want to reduce friction, making it the best experience possible for both our clinicians and for our clients. So, just from the time that we have a job, how do we get that clinician through the process as seamlessly as possible? And so we're looking at what those bottlenecks are, where we have the hangups, and just making sure that we're refining that where we have the best clinician experience, and that we are then delivering the healthcare workers to our clients to get them to the bedside in the lab and ultimately taking care of patients, because that's really what we're in the business to do. So that's really what I'm focused on, is how do we do that better, and then how do we grow market share?
And before we close today, is there anything else that you would like to share with our audience?
I would. Thanks, Robin. This has been a lot of fun. Thank you for having me on the podcast. I would just like to express extreme gratitude for our allied health professionals, as well as our nurses who make coming to work at Trustaff every day such a pleasure, and the work that they do for patient care and how critically important that is. I personally am not a clinician and thought that at one point in my life that I would have been, but it just wasn't the path for me. So this is a way that I get to be fulfilled in, caring for others through the work that I do with Trustaff. And without our wonderful clinicians, it just wouldn't be possible. So I would just like to say thank you to this group, and especially as we're going into the Allied Health Professionals Week, and just recognizing that group and just how important they are to us. And so just thank you.
Great final words from the president of Trustaff, Kelly Duggan. We definitely thank you for your time today. It's been great learning more about you, and I love all the advice and tidbits that you shared with our audience. Thanks for being here.
Thanks so much.
And to our listeners, we hope that you will join us again on The Clinician Voice.